Hey everyone, and welcome to this week's COVID-19 office hours. I'm going to just spend a very brief moment going over some logistics, and then we will get right to the presentation for today. So, housekeeping tips for all of us, just a brief reminder that we are recording the webinar today, and a copy of that recording along with the slide deck and the content from the chat and the Q&A will all be posted to the HUD Exchange in just a couple business days. Quick technical reminder for audio, if you are having any challenges hearing us at any point during the webinar, we encourage you to switch over to your phone audio. You should see in the chat messages right now, just the information that's up there on the screen regarding both the call-in information and the access code. All of us will remain muted for the duration of the webinar, but we absolutely anticipate hearing from you all during the session by way of the chat messages. So on your screen right now, if you look on the bottom all the way towards the right, you should see what's highlighted in the red box on your screen right now, which is just the chat functionality. If you click on that, please send all of your questions, comments, feedback into that chat functionality, and we will be sure to respond to those during the webinar. When you send those messages, just take a brief moment to make sure that they are going to everyone. It should default to everyone, but if it does not, just go ahead and where it says to, all the way over to the right, click on the arrow and scroll down a bit and you should see everyone. If you have any technical issues throughout, just put a message in the chat box and we'll do our best to help you. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you very much, Natalie. Welcome, everyone, to the office hour session today. Again, my name is Norm Suchar with the SNAPS office. You'll also be hearing from Marlisa Grogan today from the SNAPS office, and we have several other snappers waiting to answer your questions, either live and out loud or in the chat window. Strongly encourage you to use the chat window both to ask questions and to share any experiences that you have, comments, things that have gone well, things that you're struggling with. I know many of your peers out there are really interested in hearing about experiences from other communities. Going to the next slide, please. We also will get an update from Emily Misaitis from the Centers for Disease Control and Prevention. She will both provide us with a COVID update, but also a brief discussion about vaccine acceptability. So very much looking forward to that. We have some technical assistance resources and flyers that we want to share with you today. I will note that we do not have any updates on COC funding or YHDP or the PIT count today. So if you're staying on just for those updates, we will not have any updates for those today. But we have a lot of great content, so we're going to move right into things. Let's move on to the next slide, and I'm going to turn things over to Emily Misaitis from the CDC. Emily?
Hi, everyone. Thanks so much. I am going to go through our regular update and then go through a couple slides about our strategy related to vaccine confidence. So next slide. So what we're seeing, I've changed this update slide a little bit just to reflect the cases in the last day. So normally I talk about the cumulative cases that we've had since the beginning of the pandemic, but things are increasing so much right now that it's worth mentioning that on December 2nd, the last update we have of numbers, there were 196,000 cases and 2,700 deaths, unfortunately. So really seeing this third peak is very high. We had a little bit of a leveling off, but you can see that it's starting to increase again, and we do expect it to continue increasing through the throughout December. Next slide. I have a little bit of information here from the Universal Testing Dashboard. We don't have a ton of entries to share. So thank you to those who have entered data into this dashboard. So when we're talking specifically about testing events that have happened in homeless shelters, we have data for 295 testing events covering over 11,000 clients tested. The average positivity around, still around 8%, 2,500 staff tested, and an average positivity around 4%. But what you can see in the graph on the right is pretty representative of what we're seeing in other data related to homelessness, specifically in COVID cases. We saw a big peak in positivity here in this graph in the spring. And then over the summer, positivity rates were fairly low, even though we saw increasing numbers in the general population. But unfortunately, we can see looks like a very big jump. On this graph, that's likely due to just small numbers of entries, but it is reflective of what we're seeing also in emergency department data as well, that we're seeing an upward trajectory in cases among people experiencing homelessness. So that is something to be aware of, that it is certainly spreading very widely in the general community, and we are also seeing that upward trend among people experiencing homelessness. Next slide. So I want to talk a little bit about the vaccine, and we are learning a lot. Just in the past week or so, and the past couple of weeks, so much more information is becoming available about the vaccine as the couple front runners are coming out of their clinical trials and moving towards FDA authorization. So right now, I think probably many people know that Pfizer mRNA vaccine is under review at FDA for emergency use authorization, and CDC will then create a recommendation based on a review of the data. After FDA has completed their review of the data for approval, CDC will then create a recommendation for use. CDC has also just recently created a recommendation for some of the first priority groups that will be getting the vaccine, and they included healthcare workers and residents of long-term care facilities in the first prioritization from CDC. That will ultimately come down to the states when it comes down to distribution of the vaccine. Those prioritizations can be adopted by the states, or the states can choose their own prioritizations. So we will be learning a lot more as this very dynamic process moves forward. So one thing that is incredibly important, though, is that these vaccines are not going to be useful at all if they just stay in a very cold freezer. So we want to make sure that people are open to getting the vaccine and have enough information to be able to do that. So I'm going to go through a couple slides on strategy for that. Next slide. So accessibility, there have been some polls on how the general public is feeling about vaccine acceptability for the COVID-19 vaccine, and it's been going up and down a little bit, and most recently in October, the numbers were, not great, kind of in the middle, right? 58% of the general public said that they would be willing to receive a COVID-19 vaccine. People were concerned about side effects, worried about whether or not it would actually work, worried if it's, had any risks associated with it, and whether or not they were worried about COVID itself, and whether or not it might be expensive. People thought that vaccine would be more acceptable if they talked to their healthcare provider with it, if it didn't cost anything, if it would help us get back to kind of normal functioning at school and work, and if it were easy to get. Next slide. So kind of a similar concept here. A lot of people really in the middle, taking a wait-and-see approach and wanting more information about the COVID-19 vaccine. This makes a lot of sense because we haven't had a lot of information about it, and we're getting a lot more information, and there's a lot to digest. So it's going to be our role at CDC, and hopefully, ultimately, a lot of people on here will learn enough to also be able to share the information from good data sources. Next slide. So 3 things that we're thinking about as we think about vaccinating with confidence are making sure to reinforce trust, empowering healthcare providers, and engaging communities and individuals. So I'm going to go through each of these in a little bit more detail. So why don't we go to the next slide. When we are talking about reinforcing trust, this is very much about clear and accurate vaccine information. This vaccine, as I mentioned, there hasn't been a lot of information yet. There's a lot of misinformation. I think there's more misinformation than actual information. This is going to be so important, and this is very much on us to make sure that we're communicating transparently, providing regular updates, and addressing the spread of misinformation. So I hope that you all will hold me, at least, to task on this and make sure that you're getting the information that you need to feel confident in the vaccine. All right, next slide. So next, we really want to be thinking about our healthcare providers and you all connecting with healthcare providers if you're not a healthcare provider, connecting with your own healthcare providers and connecting with the healthcare providers that you work with is going to be really important. Healthcare providers are going to be some of the first people prioritized for the vaccine, and they also are going to be the ones recommending it to their patients. So connect with them to make sure that you know information from them and that they'll be able to provide that information to the clients that you're serving as well. All right, next slide. And then finally, engaging with communities and individuals. This is really important, and this is where you guys come in so much as helping with this rollout. Working with you all is going to be crucial to making sure that we can get vaccines not only to yourselves and your staff, but also to the people that you're serving. So you all have these relationships with people experiencing homelessness. Those can't be built in a single day, and so it's going to be incredibly important for the people with the vaccine, so the public health providers and the healthcare providers, to be working with you all to make sure that there's open conversation, that you're able to connect with the people that you're serving, that you have all your questions answered. So there just really needs to be multi-directional communication. And next slide, that might be it for me. Oh, and just addressing myths and misconceptions about COVID-19 vaccine is going to be really important too. Kind of the common myths that come about, for example, like with the flu vaccine. A lot of people will say they got the flu from the flu vaccine. That's not quite what happens, but you can feel, a little bit sick after you get a vaccine because you're having an immune response. Knowing that people that have already gotten COVID-19 might still benefit from getting the vaccine. Knowing just that, the vaccination can help end this pandemic. That is incredibly important for everyone to know. So now I do think that's it for me. So next slide. I would be very happy to answer any questions. And like I said, I hope that you all will let me know if there are things that you need to feel more confident about the vaccine. And I hope that you will let your clients know that whether or if, and hopefully you are, feeling confident about vaccination as well. Thank you so much.
Thank you so much, Emily. I just wanted to ask a question related to winter shelter that we've been getting a little bit of. So I know this winter a lot of shelter providers are facing tough decisions because they've implemented distancing and spacing, but then they don't want to turn away people who have who are out in the cold and need a shelter bed. Can you talk about how people should be thinking about that trade-off and what shelter workers and intake workers should be thinking about as they think about that trade-off?
Sure. This has been a concern certainly at the front of our minds since the weather started getting colder, and it's been something that has come up across the country. So the way that we've been thinking about it primarily is that you don't want to get to the point where someone is at the front door, it's freezing cold outside, and you don't have enough space. So planning is going to be crucial to make sure that you're going to know first that you might have space available, that there's a space for that person to go, in case you don't have space. And then finally, making a plan with the people working the front desk about what is going to happen. We can't really make a blanket statement here because each situation, when it comes down to something like that, is going to look a little bit different. But for your shelter and for the services you're providing, make a plan for what happens if you get to that point, and hopefully you won't get to that point.
Great, thank you so much. We have a couple other questions here that I wonder if you could try to answer. One is somebody's asking about whether there's going to be a media campaign to discuss some of the things you've talked about with respect to giving people confidence in the vaccine. Do you know if there are plans to do sort of a big push in the general public around vaccines?
That's a great question. So we have a task force that's working on vaccines specifically, and there's a group that's working on confidence itself. And they are right now what they're doing is coming up with a big toolkit on making sure that people have information that they need to know. I am not sure if there's going to be a media campaign, but that's a great question. And I think it gets to a good point is that, we need to be using the channels that people access. So I'll take a look into that because I'm not sure the answer to that.
Yeah, and I think the question actually also has a second part about particularly addressing people of color's reluctance and concerns about vaccinations. Do you know if there are sort of any special efforts that address some groups that have good reason to be suspicious about vaccinations and things like that? Whether any of that kind of planning is going on?
Yes, absolutely. So that is a very good point that I probably should have brought up. There are very large differences in vaccine confidence by race and ethnicity. And though that is crucially important, to moving forward with vaccination, given that we know that there's a difference in burden of COVID-19 in, Black and Hispanic populations across the U.S. So that is incredibly important. And the Vaccine Task Force is absolutely working with, their goal right now is to work with organizations within communities that already have existing relationships. So it's not going to be like CDC showing up with a vaccine and saying, here, take this. So it's going to be working with partners that already have good relationships, and also very much about a two-way dialogue. So that's something that's really important that the vaccine side of the house is thinking through very carefully because we want to acknowledge that that's incredibly important.
Great. And I think you made a point earlier that I think I guess I sort of want you to reiterate about, because we have a couple questions about how do people advocate for people experiencing homelessness to be prioritized, and for shelter workers and outreach workers and other people who work directly with people experiencing homelessness, how to advocate for them to be prioritized for vaccinations. Can you talk again about where those decisions are ultimately made and how people should go about that?
Yes. So I can say that people experiencing homelessness have certainly been on the radar in these conversations. So the national recommendations will be made by the Advisory Committee on Immunization Practices that is based out of CDC. And that committee is going to be making the prioritizations for the next groups. Hopefully sometime soon we'll be hearing about what the next groups in line might be. But then once the vaccine is distributed, it is going to come down to the prioritization schemes of the states themselves. And they may choose to adopt the ACIP recommendations, or they may choose to do it slightly differently. There are two groups to be paying attention to. One is essential workers. So Right now, shelter workers are considered to be essential workers. And so where you see that in any discussion of prioritization. And right now, ACIP has been talking about essential workers, I believe, in the next priority group, so 1B. So right now, they've already decided long-term care facility residents and healthcare providers in 1A, essential workers, I believe, in 1B, and that will be the next discussion we have. And then the other group that to pay attention to is going to be people living in congregate settings, and I'm not sure where that's going to land. So that's going to include people who are in homeless shelters and also people who are in correctional facilities and other group homes. So that's kind of how the conversations are going so far. Most state plans do include specific mention of people experiencing homelessness. If you are concerned about not being on the radar in your state, it's probably worth connecting with your state health department just to talk about what the plan might be. So that would be my recommendation, is connecting with the state health department.
Great advice. Thank you so much, Emily, for all that information, and well, thank you very much. So we're going to move on to the next part of our agenda here. Marlise is going to give an update on some technical assistance resources. Please keep your questions coming in the chat window. So now I'm going to turn things over to Marlisa. Marlisa?
Hi, everyone. With the number of COVID infections on the rise right now and the cold weather well underway, it's really important now, as it's as important now as it's ever been, to reinforce your infection control measures and to make any necessary improvements to your shelter facility management. And in that light, we're going to go over some infographics that we've recently posted on the HUD Exchange. They're accessible right now. I think there's one that's going to be posted on Monday. I'll let you know when we get to that one, but we just wanted to share these with you all so that you could see them and then make use of them, depending on whether you're a shelter provider or a continuum of care member, that you may share them with your providers. We made these as accessible and as straightforward as possible, so they take out the guesswork and help you help both staff and shelter residents to stay as safe as possible. Next slide, please. So this infographic gets at symptom screening, and we've also included links at the bottom of the slides to the CDC guidance so that you can get more detail and their recommendations for screening and shelter sanitation as we get to those topics. But shelters should be regularly screening shelter residents for COVID symptoms, and they're all listed here on in this infographic. You can see the typical ones: fever, chills, new or worsening cough, headache. So all of those symptoms are listed right there, and it gives shelter staff and both shelter staff and shelter residents a quick visual about what symptoms they should be looking for and then what to do if they're feeling those, especially if there's any persistent pain or pressure in their chest, trouble breathing, so the really emergent symptoms, and when to take the next step of calling 911 and getting emergency help. Next slide, please. We also have an infographic on facility procedures. It's really important to establish alternate care sites for healthcare providers to be able to offer medical care and sheltering in non-traditional environments where that's necessary. So some non-congregate sheltering options are hotels, motels, and other large public spaces like community centers. And Emily was getting at this, the planning ahead of time to know what to do in the case where someone needs to isolate or quarantine, or if your shelter's at capacity and you need another site, another place to be able to provide shelter for someone. So this is a flow chart that goes through the situation when someone presents to a shelter with with, or if when a shelter resident is exhibiting symptoms or gets sick, and then a series of decision points if they have emergency type symptoms, calling 911. But if it's less emergent symptoms, whether to either if they're a staff, sending a staff home, if they're a shelter resident, either having the resident offering to assist the resident for getting tested and then waiting for results, or if they cannot get tested, what to do, and then if there's a negative test or a positive test. So this is a really great reference for shelter staff to have, just to know what the next steps can be in a situation where someone's exhibiting symptoms. Next slide, please. This infographic is just sort of summarizing at a glance shelter sanitation procedures, and at a minimum, it gives a shelter a sense that they're ready when they've taken these steps. And we also wanted to take this opportunity to highlight the importance of shelters adjusting their operations if they haven't done so already, making sure that there are extensive cleaning schedules in place, expanding the use of outdoor spaces, which, you know, it's much more difficult to do that now, but if not outdoor spaces, then other spaces that may not ordinarily be used if they're available, converting to 24-hour access. The link to CDC's guidance on environmental cleaning and disinfection recommendations are linked here. But just doing simple things like making sure that hand sanitizer and soap is always stocked, that there are extra masks on hand, that you're trying to socially distance and avoid congregate meals and, you know, doing individual bagged meals, having a bathroom sanitation schedule in place, rotating meal times and access to showers, using fresh air or improved ventilation wherever possible. And CDC also has their updated or their guidance on ventilation resources on their website as well, which is a really great resource to check out. And then making sure that common areas and partitions are disinfected. If you are working at a shelter or managing a shelter, or if the shelters in your continuum haven't taken these steps yet, this is the time to do it, and you can save lives by taking these steps. Next slide, please. Along the lines with facility procedures, making sure that your layout is organized so that you are ready to minimize or actually enforce your physical distancing procedures, so having designated entrances and exits, lines at the bathroom, identifying what 6 feet is so that people can stay physically distant, putting direction flow markers, and making sure that your beds are spaced out every 6 feet at least. And then also, again, maximizing outdoor space. So a good infographic for staff and just a reference point to see if you're able to check all of these off of your list. Next slide, please. And then more specific to shelter planning, as with all of the other steps as well, sanitation, facility layout, your facility procedures, like knowing what to do when someone exhibits symptoms, coordinate with public health partners, and that, and checking against, checking with the experts in the measures that you're putting in place, but then also in planning for winter, not just so that you have a check on what you're doing meets like infection control measures and the standards that are being recommended, by the CDC or by your local public health departments, but also to make sure that your community is availing themselves of all resources and ideas and partnerships that you can. So this will help with being able to keep shelters at decompressed levels, which is really important, even more critical now in the colder months where we want to keep people off the streets and out of severe weather conditions. And setting up non-congregate shelter is also going to be really important to prevent outbreaks in the homeless population. So a key step in being able to maintain social distancing. And this planning is what will help your shelter, frontline shelter staff, avoid the situation of having to choose between getting someone in from freezing temperatures and overpopulating your shelter and not being able to maintain social distancing. So in this bullseye graphic, which will be posted Monday, we're hoping, it's really a reference for system leaders, planners, to help you maintain your congregate shelters at a reduced capacity. And these are steps that you can take, including supporting alternative spaces for winter sheltering in the green. So use your non-congregate sheltering resources. Put people up in hotel and motel rooms. And then you can also reference our alternative sheltering options document, which gives you other ideas for what to do, like other public facilities that you could adapt for non-congregate sheltering, expanding medical respite programs, maintaining active outreach to encampments, so keeping that line of communication open, making sure that people in encampments in your community have that line to survival, safety, just essential resources, and making sure that they have the assistance that they need to stay safe and survive in cold weather situations. When taking a step forward, when you've maximized your alternative spaces, strengthening your diversion strategies. So are there people who are presenting at your shelter that could be diverted from shelter using flexible cash assistance, mediation and connection with family and friends, and using other benefits that may be available in your community so that they don't have to come into shelter. And in addition to coordinated entry, or what could be part of your coordinated entry, a dedicated hotline to triage needs. And then finally, when someone does need to come into congregate shelter, making sure that you have referral options and resources ready so that, people stay in shelter for the least amount of time necessary. At the same time, maintaining low barrier access. This is not meant to put up barriers, but to try to help people avoid shelter when possible, while at the same time making sure that people who need to come into shelter absolutely can. And then providing funding for short-term motel vouchers, providing transportation to alternative shelter space, and then again, going back to number one, the green section, making sure that you have a plan, that your community has a plan, that when someone is in a hotel, motel, or other non-congregate sheltering setting, that there's a plan, a really concrete plan for rehousing those people and making sure that when they exit, they're exiting into a housing situation. Next slide, please. So we spoke about this way early on when the pandemic started, and I think it's worth repeating, especially now as many of you are facing really critical decisions and much more stress, much more pressure, and many difficult situations with the increase in infections. We know that at the same time, closing a shelter during this period could really have serious health implications, not only because of the cold weather, but also because of the increased disease spread that's possible when people are turned away from shelter doors. So Continuums of Care, you have a critical role in actively reaching out to shelters in your continuum, both publicly and non-publicly funded facilities, to make sure that you're aware of their resource needs, you're helping them problem solve, and you're reaching out to other sources of support, such as HUD TA, when shelters are facing the tough decision to shut down. And there are, again, steps that you can take. Next slide, please. So if this is an issue in your community, please reach out immediately to your local public health partners, emergency management, to see if you can leverage their capacity, their resources, maximize your connections, and make sure that they are aware of the ramifications for a shelter closing in your community. And then 2, create a plan for alternative sheltering if it hasn't been done before, or increasing your non-congregate sheltering solutions and, planning for overflow spaces, and then reaching out to us. Please reach out to us via the AAQ, via the field office, and we are ready and willing to help you, and really hope that if you're in this really, really tough situation, that you use us as a resource and reach out to us. And that is all I have. I'll turn it back to you, Norm.
Great. Thank you so much, Marlisa. We're going to turn to our questions now, and we do have quite a few questions. I want to start with one that I'll go ahead and take. We have a couple of people who have been asking about when the CDC eviction moratorium expires. They are expecting to see a large number of households reaching out for prevention assistance, and this pandemic has dragged out a very long time, so many of them have more than 6 months of arrears, and under the ESG program, you can currently only fund up to 6 months of arrears. The question is about whether HUD is considering waiving this. This is definitely something we have heard from many people. It is something we're looking at. I don't know what's going to happen, but it is something we're actively thinking about. So we will at some point have news either way. Unfortunately, I don't really have any new information about that at this point, but great question. Thank you. We have a question that, Brett, I know you answered this in the chat, but I think it's probably a question a lot of people have about people moving across outside of the jurisdiction of their ESG funds. The question is, can an agency use ESG to provide rental assistance if a participant who was enrolled in an ESG project in one state wanted to move to a property outside of the agency's funded state? Can you talk about what the rules are around that?
Sure, and Marlisa, jump in if I miss anything. But in general, your ESG resources are meant to serve people from your jurisdiction. So as long as the person is from your jurisdiction, they meet all of the eligibility requirements, then you can use your ESG funds to house them outside of your jurisdiction. But you need to be able to meet all of the requirements in the rule, which include doing habitability inspections, in regular ESG, that's case management, your reevaluations. A lot of that can be done virtually. So if you can find a way to do that, then absolutely you can help someone move outside of your jurisdiction.
Great, thank you very much. And does, like some of these, if somebody moves far away, like doing an inspection might be challenging. Can you talk, like if a recipient can contract with a, say, I don't know, a public housing authority or some other entity in another place to do an inspection if necessary, is that something people would be allowed to do?
Sure, you could absolutely contract with another organization in another area. But I think what COVID has taught us is that a lot of the work can also be done virtually, and we already allow virtual habitability inspections, so that's an option too.
Great. And we have a follow-up question that you also can probably answer. But that same scenario, does that also apply to COC rapid rehousing or COC permanent supportive housing? Where a person can move outside of the COC geographic area?
Yep, it does. On the COC side, though, there's the caveat that the majority of your program participants have to be served inside your geographic area. So if you have more than 50% living outside of your geographic area, then we should have a conversation.
And for COC, it only applies to tenant-based rental assistance.
Great, thank you. We had a couple questions. I know at the beginning I said we didn't have any updates on the COC funding process, but we did have a couple questions I want to address. People are asking whether I can say anything about the COC, timing of the COC competition. This person has heard that Congress is working on language that would allow us to fund awards non-competitively. And are wondering how long it will take once that happens and how quickly that will all happen. So I can't speak with any certainty about timeframes or anything like that. I will say we have been working to sort of set the stage for this. So if we do get congressionally approved language, I think we can sort of move in the order of several weeks. It won't take several months to get things out. So we are trying to be ready to move very quickly. I very much hope to have news about that soon, but again, we're still waiting for Congress and a few other things to fall into place. And we will provide updates either through the listserv or through these office hours, probably both, as soon as we have any updates. Great question, thank you. So let's see, we have some other questions here. We have a question about, and again, I know we answered this in the chat, but I think this is probably something that a lot of people are going, or a scenario a lot of people have. We have a question about ESG funds. If somebody's, say, a rapid rehousing program participant, and they were originally assisted with annual ESG funding, but then that funding ran out, and so they switched over to ESG-CV funding, and maybe they will again switch back to annual ESG funding. Are there any additional requirements? Any problems with that, or what do people have to do to make sure they can do that without getting into any trouble? Brett, I think you were the one who answered that in the chat box. Do you mind talking about the answer to that?
I answered that one. I don't think I remember answering that.
Oh, I could be wrong. Maybe it was Marlisa. Did you answer that, Ebony?
I did not, but I can answer it.
Great. Perfect.
Okay. So, there may be, in general, you should be familiar with Section 4 of the ESG-CV notice and make sure that you are documenting that your annual funds are being used for coronavirus response. Again, it's important to know that the level of documentation that we are looking for in your activity description in IFDIS is at the activity level. So we're not looking to see that you, for rapid rehousing, for example, that you are doing an income test, or for homelessness prevention, doing an income test and identifying that someone's lost their income or their housing, or is in an unstable housing situation due to COVID in particular. We are looking to see that you are using your ESG funds and your street outreach, rapid rehousing, homelessness prevention activity as a part of your community's coronavirus response. So keeping people in their housing, off the street, getting people from shelter into housing, those are all measures that that can help reduce the spread of infection. So that's the level of documentation that we're looking for. So make sure that you're documenting the connection between the annual use of your ESG funds with coronavirus response, and then you will be able to administer your annual funds in the same way as your COVID funds, so that you'll have the same waivers that are available for your ESG-CV funds as your annual ESG funds. You will have different expenditure deadlines, so there are some differences in the way that you're going to be tracking your annual ESG from your ESG-CV. But we are also working on a tool which should hopefully be available pretty soon that where you can actually plug in your annual and your ESG CV money and dates, and then be able to see what your deadlines are and, you know, where caps may be still in play for annual ESG funds not used for coronavirus response. So stay tuned for that. But I would say the biggest thing to do to make sure you don't get into trouble is document that you're using your annual ESG funds for coronavirus response.
Great. Thank you so much. And while you're on, Marlisa, there's another question. Well, there's a question related to the obligation deadline, the recipient obligation deadline. The question is, if a city or state allocated all of its ESG funds by the obligation deadline, but then a subrecipient later returns funds that they're unable to spend, can those funds be reallocated to another subrecipient, or have they just missed the obligation deadline at that point and they have to get the money back?
No, if you meet the initial obligation deadline, then just make sure that you're documenting that very clearly. And if unforeseen circumstances occur, like a subrecipient, you know, being unable to use the funds and they return them, then you've still met the initial obligation deadline, and then you can just reprogram them or reallocate to another subrecipient and then continue on without having to forfeit those funds.
Great, thank you very much. One last question I want to throw in. Want to direct this to you, William. Somebody has a question about whether a COC can use their planning funds to buy technology equipment to assist with their point-in-time counts, something like tablets. Can you talk about that?
Yep, that's a great question. You do have the flexibility to use your planning funds to acquire technology for your point-in-time count. We certainly encourage you to think about the broad scope of your planning grant. You can do a lot of things under your planning grant to pay for your point-in-time counts. That could include PPE, or again, technology to assist you, or other things you may need. So great question. Encourage you to use that planning grant well with your point-in-time count needs.
Thank you very much. We have a couple questions about for CDBG and SSVF. Unfortunately, we don't have anybody on the call who can help us with those. We will take those back to the respective experts in those topics, and we will talk about those on a future call or maybe in a future technical assistance document. That brings us to the close of our session today. I want to thank everyone, thank all our presenters, Marlisa, Emily, and everyone else, and the SNAPS team, our TA providers, and again want to thank everyone. You're doing great work, and I especially want to thank people who shared their challenges and their suggestions and their questions in the chat window today. Thank you very much, and we look forward to seeing you on the next office hours. And that concludes our webinar today. Enjoy the rest of your day.